Good day, everyone. Welcome to another episode of the Governance and Policy Podcast by the Adam Smith Center, Singapore's first and only organization promoting pro-market values. The aim of this podcast is educational, to demonstrate the importance of economics, public policy ideas, and the humanities in general. I'm Joshua, and I will be the host for today's episode. Today, we are joined by Philip Stevens, who will speak on trade and innovation in combating COVID-19. Philip was a director of policy for the International Policy Network and an official at the World Intellectual Property Organization before going on to found the Geneva Network. Thank you for joining us today, Phillips.
Good morning, Joshua.
To start us off, how important do you think the cross-border trade of medical supplies is in terms of the global coronavirus response?
Well, actually, I think it's crucial, and nothing can be done without trade. So think of all the things that are needed to mitigate or tackle COVID and prevent its spread, bearing in mind there's no effective treatment or medicine or vaccine available yet. So you have most obviously hand sanitizer and soap. We're being urged by governments and public health authorities to constantly wash our hands. So soap is needed by everyone. There's face masks. I know people in Southeast Asia are already pretty good at wearing face masks beforehand, but now people in the West and elsewhere in Africa and Latin America are being urged to wear face masks, much more than in the past. So suddenly we need loads of face masks, which a whole new market is needed to supply those face masks. You have protective equipment for not only for people working in hospitals. You need dentists need them now much more so than in the past. Cleaners, people working in public transport, people working on aeroplanes as their flights start to come back into circulation a bit more. So suddenly there's a whole new demand for face masks, plastic gowns, vinyl or rubber gloves, those sorts of things. So yeah, there's a massive need for those sorts of things. And don't forget that these things are not normally made at home by each country. They're normally made in a number of different places and then spread or traded all around the world. Imports, exports, standard. So to keep those products moving is absolutely crucial. And then also we have the devices and medicines needed to help people who've already been infected by COVID. So you have
like respirators, right?
Yeah, the extreme end you have for those unfortunate people who get really sick, they need ventilators. And again, those are not necessarily made in more than a few countries, but people everywhere need access to them. So trade, keeping the boats and keeping the planes going is crucial. And then medicines and even basic things like paracetamol. Not every country makes them. So, but if you've got a fever or high temperature, you need these basic drugs. So yeah, keeping the borders open, keeping goods flowing, keeping the customs checks operational, all the paraphernalia and infrastructure for trade needs to be working better than ever to keep the pandemic under control and to try and move things to a more positive direction. So yeah, trade is absolutely vital to this response. And then don't forget all the things we need to live: food, drink,
yeah, definitely,
you name it, we still need it. So that need has not gone away. So trade is so important at the moment, and it will become more so important as to help us get out of the economic problems that we're going to be facing as the lockdown ease. I don't think any country is going to get rich by shutting their borders and trying to build up their own industries. That has been tried many times in the past, in the 60s, 70s. It failed every time. So free trade will be crucial for stopping the spread of coronavirus, treating people who are sick with it, and for building our economies as the lockdowns end.
I think you mentioned the food and like necessities trade as very important, very, very poignant, especially to us here in Singapore, given that almost 80% of our food comes in through global trade. So how do you think coronavirus has impacted this cross-border trade, especially in terms of medical supplies?
Well, medical supplies, it's an interesting case because early on in the crisis back in March, suddenly lots of countries were experiencing shortages of basic medical supplies they'd been taking for granted.
Yep.
So there was shortages of rubber gloves, for example, face masks here in the UK, where I'm speaking from. There was a massive shortage of medical grade face masks, and they were being heavily rationed, really only for people at the front end of medical delivery. Whereas I think in where you come from, they're quite easy to come by, and people wear them pretty readily. So there were shortages of those sorts of things. There have been shortages of PPE, which is personal protective equipment, all the visors and plastic aprons, all that sort of stuff. Lots of countries have faced shortages of those. And even things like paracetamols and antibiotics, basic essential medicines, because countries have been restricting the export of certain parts of the medicine manufacturing process, notably active ingredients. The drugs that are not necessarily related to COVID-19 have been in shorter supply. I remember going to the chemist recently, and there've been, I think it's eased off a bit now, but there are restrictions on the number of paracetamols you can buy, which, I've never seen anything like that in my lifetime, because paracetamols are abundant and cheap. All of a sudden, not. And the reason why is because lots and lots of countries, the exact figure, the last time I checked, was about 80, and that was about 2 or 3 weeks ago. There's about 80 countries had been identified by the World Trade Organization of instituting new trade barriers to these products. Most notably, they've export bans. So the idea being that in order to safeguard your own country's supply of a certain product, they've been banning their export and very heavily restricting their export. The idea being that you keep hold of your own stock, your own supply in the short term. Yes, in the short term, you will guard your existing stock of medicines, face masks, visors, whatever it happens to be. But the reality is, in the longer term, and actually in the medium term, that creates global shortages, and including for yourself. Because
there's no longer trade, right?
Exactly, trade is curbed. So, firstly, is you're hurting all your neighbours and all your friends, because you're no longer able to send the stuff you manufacture to them. But it's highly disruptive for many ways. Think of the manufacturers themselves. They're used to planning how they trade in these products. They're used to their suppliers, and they're used to their export markets and their customers. All of a sudden, they're being told that they've got to stop supplying those markets, and it really badly impacts their ability to plan for the future. So they don't know whether to increase, decrease, and it creates capacity problems for the manufacturers themselves. It also creates really bad beggar thy neighbor sort of mentality between countries. So you are going to impose export bans on me, well, I'm going to have to do the same to you. So it creates like a spiraling effect, and it can hop from product to product. So countries will retaliate with the export curbs on other products. So suddenly, if you're Singapore, a manufacturer of, I know you're not, but if you're a manufacturer of face masks, Colombia might say, right, no more bananas for you guys. So you end up with this sort of negative sum trade war based on export curbs. And also think of the people in developing countries, or countries that don't have any manufacturing capacity, which, most of sub-Saharan Africa, many Latin American countries, some of your Southeast Asian neighbors who don't have the capacity to make these products. You're really hurting them, because they can't make them themselves. And maybe the richer countries can pay a bit more to secure some supplies, or maybe they can start ramping up their own manufacturing capacity in the shorter term. But that still leaves many billions of people left out. So from a global perspective, it's very negative and very harmful. And it's created shortages, and it should be discouraged, I think, by governments as much as possible.
All right. So on that note, what have the governments done thus far to alleviate these adverse impacts of the disruptions to trade? And what can they do in the near future to perhaps maybe bump up or like reinvigorate these trade routes and the trade relations between the countries?
Well, I think it's a political issue. So the World Trade Organization is, most countries in the world are a member of it. There's like 140 something members. But that makes it quite a cumbersome and slow forum for agreeing at a global level to reduce trade barriers to these products. Although there is a role, I'll come on to that later. But actually, notably, Singapore and a number of other countries in the region have signed a declaration to keep trade flowing in COVID-19 related supplies. So there's been a political commitment amongst Singapore and some of its some like-minded countries in the region to not institute these kind of export bans and to keep the supply chains going. Because don't forget, it's not just a one country manufacturing certain items. Maybe in the case of something simple like a rubber glove, yes, one country will be manufacturing them. But take a ventilator, for example. These are quite complex pieces of technology and machinery, and they have very dispersed supply chains. They're 700 different components in the average ventilator. Many different countries involved in each component assembled in different parts of the world and then finally assembled in another country. So keeping those supply chains open, stopping barriers to trade between those countries is crucial for that. So governments should join Singapore and the other like-minded countries to commit to keeping the trade flowing. And that, so it's not just the export bans that are the trade barriers. There are trade barriers such as tariffs. So those are import duties on products. Certainly, there are import duties on many of these basic medical commodities that are needed to tackle coronavirus. I think these are quite simple for countries to remove, especially in the short term. So take, for example, face masks. Their tariffs are worst in Latin America, up to 55% for importing face masks. Even things like hand sanitizer and soap can attract tariffs of 40 to 50% in some countries. Those add up to quite a lot for the end user, and particularly in poorer countries, that can make them out of reach for many people. So I think countries should commit to reducing tariffs, not just in the short term, but also in the long term. So for medicines, there's actually a WTO agreement. It's called a plurilateral agreement. So it's not the whole membership. It's not every country that's a member of the WTO that's signed up to this. It's a plurilateral deal, which means that there's a like-minded group of countries that have signed up to this deal. And there's one for medicines called the Zero for Zero initiative. And all signatories of that have committed to reducing to zero tariffs on medicines that fall into the scope of that deal. I might be incorrect on this, but I'm pretty sure Singapore is not a member, weirdly, for a free trading country. I'll have to double check on that. But more countries should join that deal, I think, particularly for medicines. And maybe there's an argument for increasing the scope of that medicines deal, including medical supplies as well. Face masks, protective equipment, soap, hand sanitizer, all that sort of stuff. Get all that into the deal, get more countries to sign up to it, and reduce tariffs to zero. Because tariffs are a particularly pernicious form of trade barrier, because they not only add up, well, they're aggressive taxes because they're regressive in the economic sense, meaning they hurt the poorer more than the rich, and they're doubly regressive because they hurt the sick more than they hurt the healthy. So they really are not good things, and I don't think they have a place in the modern economy. So I think we should be doing everything we can for governments to move away from tariffs on medical supplies, medicines and vaccines. So some countries have already agreed to do this outside of the WTO. They've agreed unilaterally to exempt COVID-related medical supplies from import duties. Pakistan has done that, Brazil, Colombia and Norway. There's probably some others. but that's only temporary. So that creates quite a lot of uncertainty for future exports and for the individual direction of markets. So, and they also they don't help the preparation for the next second or third wave of the COVID-19 issue, or indeed future pandemics. So I would suggest it'd be better to have a legally binding permanent tariff reduction. And the best avenue to do that is through the WTO, the World Trade Organization, through these deals I was talking about. Get as many countries into those deals, make it legally binding to keep tariffs to zero permanently. And I think the world will benefit from that enormously.
Definitely. It'll be difficult, but it would definitely have a very, very positive impact on the way we, the world targets these pandemics and how we deal with them.
Yeah, it's a difficult time because protectionism is becoming fashionable once again.
Yep,
I think countries are looking at, building up their own local capacity and using trade policy in a way that we haven't seen for quite some time to isolate or punish other countries in the world, or to protect your own interests. I don't need to name any names, obviously. I think we know who we're talking about. So yeah, it's more difficult than it was 5 years ago to do this kind of thing. But I think there's still enough countries in the world who really understand that the necessity of free trade, especially a country like Singapore, which has built itself as a local beacon for open markets and free trade. So it's great to see Singapore spearheading the initiative to commit to keep supply chains open and free. More should be done along those lines.
It's necessity for us to do so. So definitely we do have a vested interest in that. How do you think innovation, on the other hand, would fit into this global coronavirus response? And how do you think innovation will continue as countries deal with the second and third wave of cases?
There's no treatment or vaccine at the moment, obviously, so innovation will be key. But we're already seeing lots of innovation for helping us adjust to a new normal. There's new technologies coming in to help maintain social distancing. Obviously, innovation in the supply of goods and services to help us live our everyday lives in this new way without actually touching anyone. Very difficult, but hopefully, I'm pretty confident that an effective vaccine or treatment will be just around the corner, and making all this social distancing and so forth unnecessary. But innovation will be key to that because there isn't anything at the moment. So first of all, there's the treatments. That, as I mentioned, there's no treatment for the virus other than one that's been recently approved from a company called Gilead. But that, it's not a clear-cut victory, that drug. It has a bit of a marginal effect on some of the worst cases. We need something a bit more strong than that. And fortunately, there's an absolute ton of activity going on all over the world. I think pretty much every pharma company, every smaller biotech company, every university that has research capacity, government institutions, NGOs, the big charities, they're all scaling up activities in a way we've never seen before. They're all turning their brains and resources to this problem. There's hundreds of projects going on at the moment, some of which are quite advanced, some of which are now entering human clinical trials. And I think there's a great chance that there will be effective treatment available before too long. And don't forget that many of the projects that are going on at the moment are looking at medicines that already exist. So previous innovations are being built on to see if they're any good for COVID-19. So the countries that have had the most innovation in pharmaceuticals and health tech are those that are really leading the charge at the moment, because they already have that stock of knowledge. And that the hope is that when a product comes along, it will be made available to every country in the world pretty rapidly. So that's a massive challenge. I don't think we've ever seen anything like that before, because when a normally when a new medicine comes along, it's launched in probably the US first, then European Union, then maybe Japan at the same time, and then gradually over like 5 to 10 years, it will spread out through the world. But we don't have time for that with this pandemic. That new treatment needs to be everywhere as soon as possible. So that a major logistical, political challenge there. Then there's the vaccine as well. The vaccine is probably the long-term solution to this, because it will prevent people from getting sick in the first place and help develop herd immunity. So again, there's quite a lot of promising activities going on around vaccine research and development. And I can't remember how many projects going on, but there's a good 5 or 6 in clinical trials of one kind or another. So maybe by the next 12 to 18 months, maybe a bit less, we'll have a vaccine that can be effective against this disease, which is quite impressive, really, because normally it takes a good 5, 10, 15 years to develop a vaccine, from lab research at university to being there in the hospital clinic to give to give to the general population. So these compressed timelines are pretty incredible, and I think they're a testament to the ability of the private sector working with partners where appropriate to adjust and adapt to these challenges as they arise. It's been pretty impressive, I think.
But then when the vaccine and when the treatments come out, then we will be facing a sort of like intellectual property problem in a way, right? Because intellectual property will play into the way into like distribution fields and how these vaccines and treatments are able to reach the general public, or even reach across international borders to people away from the country or organization that discovered it.
Yeah, I mean, the concern is that patent rights or other intellectual property rights will mean that the owners of the vaccine, whoever's invented it, will price it to such an extent to make it too expensive for poorer countries, for example, to make monopoly profits. Theoretically possible, but I think highly unlikely in this case. I don't think any company is going to be wanting to price these medicines at a punitive rate in order to price gouge. I think that the reputational repercussions would be so enormous that as to be do more harm than good. So we saw, for example, with Gilead, when its product remdesivir, whatever it's called, when that was looking like it might be quite a good play, might do quite well. Its share price was really quite unaffected, because it was clear that the company probably wasn't going to make much money out of this, maybe cover its costs, but not a huge profitable product, even though it'd be needed everywhere. Because I don't think this is they won't have the ability to price as they wish, because their main customers will be government. They won't be selling into a private, pure private market. Governments will be the customers, and governments can bargain hard.
Right, definitely.
Not that they'd be wanting to gouge anyway, but in this terrible economic crisis, I think agreements will become between governments as procurers. And also for poorer countries, we have the Gavi, which is the international consortium which buys vaccines on behalf of poor countries. They have big negotiating clout as well. So I think pricing won't be an issue here. But I think intellectual property rights are particularly important for the manufacturing and distribution of these products, because as I mentioned, we got an unprecedented situation where this whatever drug or vaccine comes along is going to have to be manufactured at a vast scale, billions of doses in every country, and distributed in every country almost straight away, which has never been done with medicine. So you need to have coordination and control over the manufacturing process. So I think it would be a mistake to remove intellectual property rights and make it a free-for-all for whichever company wants to do it, because some of these newer complex products are very difficult to manufacture and need a lot of know-how. If you make any mistakes or get the quality wrong, it can really hurt people from a health perspective. it can create, terrible public health issues. So I think if you keep the intellectual property rights, you can have much more coordination and control over the manufacturing process, and also you can it helps you to raise the vast sums of money that will be needed to develop this manufacturing and distribution process to keep the supply chains maintained and going. So I think if run, you could just open it up and say, everyone go for your life. I think that would be a mistake, particularly for the more complex things like vaccines and so forth.
All right. Has the current situation actually affected intellectual property in any way? Or do you foresee any changes in that field in the next year or so, maybe stretching up to a 5-year mark in the near future?
Well, intellectual property rights are always controversial. I think people have viewed them as a unnecessary, particularly in medicines and other health tech. I'd say the opposite view. I think they're absolutely crucial for some of the reasons I outlined, and there's many more reasons. But I think there's been a push by the usual health activists who have spent their careers campaigning against intellectual property rights, have partnered up with other countries that are skeptical of IP rights at forums like the World Health Organization and the G7 to encourage governments to suspend IP rights or to create pools where people have to put their IP rights by coercion if necessary. So that all that's going on in the background, and other countries, Chile, for example, some other countries in Latin America have said that they'll be willing to compulsory license any new patented COVID-19 medicine or vaccine that comes out, meaning they'll be ready to confiscate the patents and make it themselves. Again, I think that would be a mistake for the reasons that I pointed out in the previous answer. So yeah, it's a big debate. I don't think the US, the European countries, and even China these days necessarily buy into the idea that IP is a barrier to access to medicines and vaccines, especially given, in the context of the IP system, we've seen an unprecedented amount of research and development and some very promising activities taking place. I don't see why we suddenly need to dismantle everything and build the world anew in this sort of collectivist way when we have the market-based system of IP rights working pretty effectively at the moment to mobilize research and development and to mobilize the private sector into action. So why fix what's not necessarily broken?
Thank you so much for this podcast, and stay tuned for the next episode. Thank you, Philip, for coming on. We really appreciate it.
No, thanks for having me. Hope it was interesting.
All right.